Welcome back inside the Now Morning Show. As I mentioned earlier, we're going to be chatting with the president of the San Juan Business Association. Actually, Natalee is going to be doing it inside your spotlight on Now.
All right, thank you so much, Raucus. It's just about 19 minutes after the hour of 6 o'clock. You're inside. Thank you so much for joining us. It's the Christmas season, but of course, with the new year, there's going to be some new rollout of policies from the government, and it's going to be affecting a lot of us. So we just wanted to weigh in on the discussion. Yesterday, we had Vivek Sharon, and I introduced him as the president of the San Juan Business Association. Well, he is a past president. There is a new president in Jason Roach, and he has joined us this morning to just talk about the Safe Zone initiative that the government plans to roll out in government spaces for public sector workers and the statutory bodies on January 15th. Good morning to you, Mr. Roach.
Hi, great morning.
Thank you so much for joining us. So where does the Business Association stand on this idea of a Safe Zone initiative?
Our position is that there needs to be more dialogue before the government makes that step. We are looking at the vaccination right now as it stands. It's very low, yes, and we understand that the vaccination will help. We are very much pro-vaccination. However, we have to understand why people are not taking the vaccine, and there seems to be a very high level of fear, and we believe that could only be overcome with dialogue. We see up to yesterday where the CWC got a judgment in the industrial court in terms of persons not being allowed to work. I'm just thinking, is there enough dialogue happening? Is there enough exploration of alternative solutions? And is it the right time? There were also information posted where we are seeing, in terms of vaccination in the public sector, over 50% of personnel in that sector is not vaccinated. In terms of national security, up to 70% is unvaccinated. Come mid-January, when the actual policy takes effect, what will happen then if people don't really buy in, right? And if workers are to stay home, if national security is to stay home, how are we going to be controlling the COVID quandrum at that time? Are we going to be shooting ourselves in the foot? So that is where we are at. We think that there needs to be a lot more dialogue.
But Jason, let me play devil's advocate. What more do you think the government can say or should say in terms of dialogue? Because we've been having these press conferences since the start, which gives people an opportunity to get their questions heard. And that has continued right throughout the pandemic on a needs-to basis. So the more we had cases, the more press conferences we have through the Ministry of Health. We've had the Prime Minister speaking, we've had different government agencies speaking, we have mass vaccination sites, we have people all the time putting information out there about, whether or not the vaccines are safe, who is supposed to be taking what vaccine. What more could possibly be said to get people to get vaccinated?
Well, there is a lot of information. I am very attentive to the press conference that we have on a weekly basis, right? But the information that we are presenting are really facts and statistics, and all of that is good. But is that really contributing to alleviating people's fears? Just for example, one of the issues with the vaccine is that there's no assurance in terms of if something were to go wrong with you. I'm not saying that anything will go wrong, but this is a legitimate fear that people in society have. How are we combating that fear, right? Is it a fear of needles? Is it a fear of some complication developing if it is you take the vaccine? And are we speaking to our citizens in regards to understanding that there's nothing to worry about? I just think that more can be done in terms of moral persuasion, and the correct conversations have to happen. For example, we want to adopt this policy within the government. Are we talking to the trade unions to ensure that when it is we do decide to make a decision, there's not so much trouble and discourse with regards to the
had
body.
a press conference yesterday, and he did indicate that the Office of the Attorney General and Legal Services did write to a lot of trade unions and some of them had responded. So obviously there is some dialogue going on, at least at that level.
Right. Well, if there's dialogue happening, right? Even in terms of the business sector, is there enough dialogue with the government in terms of what the plan is in terms of managing the situation? Yes, dialogue could be happening, but are we at a point where we could find consensus or a middle ground? Right?
Do you think we'll
hard
ever
on us.
find consensus with something like this, though? The population obviously seems very split. There are those who will just, as you say, drink the Kool-Aid, and there are those who will tell you that it's not Kool-Aid. You know, if you want to put it that way, that obviously if we were able to get that consensus, we probably wouldn't even be having this discussion this morning.
Exactly. Right. But it's very unfortunate, right? But we are hopeful that through the coming weeks, more discussions could take place, right? And hopefully by the time that the government is ready to implement, all goes smoothly. But we really believe that more discussions should happen across all sectors and all stakeholders.
Is the association a part of the Confederation of Regional Business Chambers? Because
No.
Mr. Sharon spoke yesterday in his capacity as chairman, and he's saying that, you know, yes, they welcome the initiative. They think that the government is doing the right thing.
No, we are not a part of the Confederation. We have withdrawn based on reasons that we believe was inappropriate and unprofessional, right? We do not belong to the Confederation. The idea of that confederation representing smaller business chambers, right? One of the issues that was present in when we were part of it is communication going back to our directors, communication going back to our members, right? We don't want to just simply have discussions and just talk on behalf of our members without consulting with them. And that is one of the critical reasons why we saw it very inappropriate for us to be a part of an organization that operates like that.
So was the pullout as a result of this idea of vaccine safe zones and the fact that there were positions put forward without consultation with the small businesses?
Coincidentally, no, it was not, right? We pull out for our own ethical reasons. It just happened to be a coincidence that this whole thing came out together. However, we really believe that, well, the fundamental reason why we pulled out is a matter of ethics, professionalism, and it's not something that we wish to be a part of at this time.
So it seems as if communication is an issue all around, because you believe there isn't enough dialogue, you know, between the government and entities in terms of determining the way forward. And you suggested that, you know, there are alternative solutions. Would you like to, you know, explore that with us? What do you think those solutions can look like, if not, you know, the safe zone initiative that the government is going to institute come January 15th?
Well, for one, testing is a big issue for me. We don't believe that enough testing is happening. Even in terms of self-quarantine, a decision was made recently with regards to persons being on self-quarantine. They don't have to get a fit to work to come back to work. And how do we really manage that situation? Because they're not required to test to come back to work as well. Right? So there seems to be a lot of contradicting issues in terms of setting how do we manage. If you get infected in the workplace, how do you manage at home? We are asking people when they're at home to take care of themselves, right? But do they have access to treatment while they're at home? And how do they get treatment? So we're making a lot of assumptions, but we really have to have more discussions in that regard to understand what is really happening on the ground, because people are hurting, and we really want to come through this together in a way that we could all be comfortable with.
Right. So you believe that there's definitely room for the ministry to do more with contact tracing, testing, and just overall in terms of treatment options? Yes,
it has almost been 2 years, right, that we are battling with this pandemic. But when you look at the statistics and the facts, right? If I'm not mistaken, we are almost at 500,000 people tested for for the COVID vaccine, for the COVID virus. So that is almost one third of our population, right? How are we really battling this virus? So I believe more could be done in that regard.
And you really believe that if they were testing more, tracing more, having different treatment options, that we wouldn't need to be having mandatory vaccination? Is that what you're saying?
I wouldn't say that we wouldn't need to have it, but I would say that we would be in a better position, because there are a lot of, let's face it, with the virus as well, there are a lot of asymptomatic people walking around that don't know that they have the virus, right? And the only way that you would know is if you test them. So yes, we are implementing COVID protocols. Yes, we are implementing safe zones. Yes, we want to hit a particular target in terms of people vaccinated. Then there's also the other issue of people that acquire antibodies naturally from being infected previously, right? So there are plenty moving parts, and I'm not so sure that we are all on the same page.
Right. And, what do you say to those countries, those developed countries or even developing countries that have the vaccinations, have been doing the testing, doing the contact tracing, and somehow are in similar positions that we are in terms of the numbers still going up, still having deaths? If that was tested and proven, obviously, I think it would have made a significant difference, but I don't know that we're necessarily seeing that.
Well, there's another issue arising, that the actual PCR test, it seems to be very inaccurate, or somewhat inaccurate in my opinion, right? You're getting a lot of false positives, you're getting a lot of false negatives. And when we observe what is happening around the world, a lot of information is now coming forward that the PCR test is less effective in detecting these new variants. They are very tricky, right? In fact, a lot of countries now are starting to look on the horizon of treatment as opposed to vaccination. So we don't know what the government research and policy is on these issues, and I hope that it is happening so that we are always ahead of the curve. But when we speak about alternative solutions, we are also looking at external information in terms of what can we do to better our position in the best possible way.
Then do you challenge or question the government's decision to just follow the WHO guidelines, because that's what it's been doing and this is where we are? Well,
at some point in time, I think the government is being responsible in terms of its guideline, in terms of the bodies that it's subscribed to. However, we have, at some point in time, you have to be willing to take some risk and think out of the box. I don't want to put it like that in terms of saying taking risk with people's lives, but we have to be creative, and we just can't say, well, all right, we just following this path and we just following it. Just for following its sake, right? There may be other options out there that could help. There may be other possibilities that we could explore. And all we are saying is that, and this is what the dialogue will do. What are our plans? What are we looking into? What hope do we have? We have to inspire hope, and we have to give the people hope, right? Because we're dealing with a situation where there's widespread fear of people getting vaccinated. I mean, the San Juan Business Association had the distinct pleasure of vaccinating our members. We did that in partnership with TTMA. And I mean, I did some volunteering work at these sites, and there were people showing up to get vaccinated drunk. And this is a serious thing. It shows you the level of fear. When it is the doctor is going to give you this needle, there are people, when it is you're seeing 3 people ahead of you and you're now getting ready to go to get your shot, there are people that are breaking down crying, terrified. So I don't want to promote hysteria, but these are the facts, and these this fear could only be diminished with talking. We have to constantly talk. That is how it is. You persuade people. You can't persuade people by actions. You have to persuade them through talking.
Right. All right, Jason Roach, we have to leave it there, but thank you so much for sharing the perspective of the association this morning.
Sure, no problem. Thank you.
Jason Roach, president of the San Juan Business Association, believes that there needs to be more dialogue and that the alternative solutions can be found outside of mandatory vaccination or safe zone policy, if you want to call it that. We're going to take a break, but much more coming up on the Now Morning Show. Stay with us.